Welcome to my Keystone. My name is Cameron Downer, and I will be presenting my project called, and it's a mouthful, Healthcare Accessibility in Latino Lusophone Communities of Massachusetts and Michigan. Super exciting. And I would just like to give a special thanks, just to start out with, for my advisor, Benet Cruz, as well as Melissa Hull and Christopher Rominger for all of the help throughout this year getting this project off the ground. So first, I just want to call our attention to some background information that I think will be important to contextualize my project. So we have two population density maps here of Massachusetts. Here we have Lusophone speakers, which, just to get that out of the way, Lusophone means Portuguese speaking. Keep that in mind. And then this is Spanish speakers population density throughout the state. And so just some kind of orienting numbers as well. So about a fifth of the US population today is Latino. In Massachusetts alone, we have 635,000 Spanish speakers. But something really interesting is we also have 220 to 280,000, depending on estimates, Portuguese speakers in the state, which is actually about a quarter of all Portuguese speakers in the entire country, which I think is a really interesting fact that people always are intrigued to hear. And so essentially, it's empirically understood that Latinos in the US are underserved in the healthcare sector. There have been many studies that have shown that Latinos broadly are underinsured, face worse healthcare outcomes than their white counterparts, and face more institutional barriers to healthcare access. And while there's a myriad of studies on these factors in Spanish-speaking communities, particularly in border regions because we see a lot more of the overt discrimination and worker exploitation in those areas. Lusophone people and their access to healthcare is a very understudied population. And with Massachusetts' population of 7 million, these two groups together really make up a substantial chunk of our cultural fabric. So here's kind of like another representation of Portuguese speakers in the US. I think that this does a good job of kind of showing some stark things. Rhode Island, Massachusetts, New Hampshire, and Connecticut really kind of form this epicenter here of Portuguese speakers in the United States. So why does all of this matter? So Massachusetts really represents a demographic mixture seen in very few places in the country. So I saw this and I really thought that I could fill the gap in the research. So by assessing healthcare access in Lusophone and Spanish-speaking communities of both Massachusetts as well as Miami, Florida, I was able to assess how these populations similarly or differentially fared in both the traditional context, like Miami, which is more Spanish-speaking kind of border region, and then a more esoteric context like Massachusetts that has a very different demographic makeup. So aside from all of this, aside from my specific project, another kind of relevant piece of things right now. So projects like this in the public health sector right now with the changing social and political landscapes are more important than ever, and they're getting defunded more than ever. There's also a lot of real world consequences to healthcare access that we don't think about. So physical and mental health really extends into many areas of our lives, and it's really important to look into these things. And most importantly, research like this offers a chance for communities in Massachusetts and Florida to implement really targeted healthcare policy. So the aims of my study, so we created a survey that was advertised in the southern Massachusetts towns of Fall River, Somerset, and New Bedford. We similarly surveyed in Miami, Florida, which as mentioned before, kind of is serving as this control city. And as a conceptual framework for all of this, we ended up using what's known as the 5 social determinants of health, which is an empirically studied framework that outlines how environmental factors can affect healthcare outcomes. And for the sake of my study, I just ended up picking 3 just for sake of ease. And so I ended up choosing education level and quality, community context, and economic stability. So now we're going to kind of start getting into the results. The survey and the promotional materials were translated from English to Spanish and Portuguese. Here are some of our promotional materials. And with the help of my advisor, Benet Cruz. And it was something really important to think about when you're translating surveys and things like this are the fact that you don't want to lose the nuances of the questions. So you want to make sure that everything you're asking in English is getting asked the same way in the target language. And so in the end, our sample sizes were a little bit smaller than we were hoping, but with about 90 total from Miami and about 70 total from Southern Massachusetts, there were still definitely some meaningful trends that we could find in this data. And also, I just want to put out there a lot of correlational data. I'm not making causal claims here. So, as I was talking about earlier, I was talking about education level as one of the 5 social determinants that I'm using. And just the most direct question that we asked was, what's your highest level of education? And so a really interesting point that came up with this is that there really wasn't a difference between the states. You can see they kind of trend together in both language groups. It kind of does this and it kind of does that. It's very similar. So we found that there were differences between the language groups. And what we found is Portuguese speakers tended to have lower education levels. And this is an interesting nuance for this understudied population. So education is a key factor in lifting people out of poverty, reducing socioeconomic and political inequities, and all of these things are inextricably linked with health and health outcomes. So this data could indicate that more emphasis on educational opportunity and promotion in Lusophone communities could help assure good healthcare outcomes in the future. So moving on to another question I asked in the survey to get at one of them. So economic stability, we asked participants to gauge their own perceived economic stability. So either being in constant worry, having some disposable income, feeling comfortable, or no worry at all. And so instead of seeing distinct trends between the language groups this time, we kind of saw stark differences between the states. If you notice, kind of it's laid out backwards to the other one. And so in the traditional context like Miami, we ended up seeing both language groups trending together, with the vast majority saying that they were in constant worry about their finances, while Massachusetts had a bit more mixed responses. In general, more people in Massachusetts felt more economically stable, particularly Portuguese speakers. But that said, over 50% of Spanish speakers in Massachusetts still did say that they felt constant worry about finances. So as stated before, economic stability is inextricably linked with health, and this could indicate something about the availability of social programs in Florida and or Massachusetts, and the need to better promote these programs in certain groups or not presenting them at all. And then we have community context. So this is kind of a broad category, but one of them that we kind of explored within community context was discrimination. So these were some surprising findings, I thought. So there were mixed results by region, but we found 2 main trends that I thought were cool. So in both Massachusetts and Florida, the most common type of discrimination for Portuguese-speaking folks was on the basis of sexual orientation. This one is like, they didn't experience any, but out of all of the experienced discrimination types, sexual orientation in both states. And you can see it's also much more prevalent in Florida, which, if you know anything about some of the legislation that's been passed in the few years, that might not be the most surprising finding. But then also, this one I found really interesting was Spanish speakers in both regions, really across the board, said that religion or discrimination on the basis of religion was something that they had experienced. And so all of that put together, discrimination of any kind has been shown to sow distrust in government, health agencies, as well as any health authorities, and then this leads to the underutilization of healthcare resources. So these trends could suggest that the broader social and political climates in these areas and how welcoming or inclusive these these populations feel can really shape people's healthcare experience. And with that, I hope you learned something today, and thank you so much for your time. Any questions? questions. I know I probably don't have like a ton of time. Okay.
Kim, congratulations on this project. Just curious to hear a little more of your thoughts on that last piece about discrimination about religion, because it surprised me a bit too. Any thoughts or context that might be helpful?
Yeah. What's Oh, okay. Yeah, no, that was something that I kind of left me as a head scratcher. I'm not gonna lie. I was not expecting that. In my hypotheses, I was expecting immigration status to be a lot more prevalent, and it just wasn't. So I wish that I could make another survey to kind of delve into that. I think that that would be a really interesting topic.
I might have a theory about the religion part for the like, for example, well, as a religion major myself, I've been involved in the African diaspora religions here, especially Cuban Regla de Ocho, Santeria groups, and
Mhm.
Olorishas. In Florida, this is more of a comment. You see interesting cases where Cubans report, well, there's a lot of Santeros and Santeras in Florida, but you also see reports of discrimination, like people complain about animal sacrifices being left in roads here and there, and there's some hostility towards them. You see it similar to in Massachusetts, where there's this reluctance where they have to hide this. Well, it's not just Santeria, but also in the other African diaspora religions, like 21 divisions and whatnot.
Mhm.
The Brazilian part, I was surprised about. Like, there are Umbanda groups, Brazilian Umbanda groups here in Massachusetts, well, I've been to. They, I guess they're different from the Olorush in this case, but with the Spanish ones, it was definitely interesting to see this statistic. I'm curious if that was somehow connected to the things you saw.
Yeah, no, it's a really interesting point to bring up. Yeah, super cool. All right. Well, thank you guys.